Welcome back. Susan Angel joins me. She's a nurse with CNS Healthcare, and she's here today to talk about what we're finding in the correlation between depression and binge eating, eating to feel better, but oftentimes it has quite the opposite effect. Susan, thanks again for coming in.
Thanks for having me.
Explain this phenomenon to us.
Well, you know, you think about mood disorders, and oftentimes you have depression, anxiety, and even the eating disorders. And sometimes, because they're all emotional disorders, the behaviors associated with each other often overlap into different categories. So you'll see patients who have binge eating disorder, which is something that you've probably seen on TV a lot lately. They're talking about that and advertising it. And then also, of course, we know depression. I'd say, you know, 50% of the patients who suffer from binge eating disorder also have mood-related disorders such as depression. Okay. So not sure, you know, sometimes a theory suggests that because you have the binge eating disorder and you feel bad about the eating patterns that you become depressed. And others who have depression oftentimes will overeat and sometimes even lead to the binge eating episodes.
And you know, oftentimes depression, and we've talked about this in the past, having depression and having anxiety oftentimes go hand in hand. And so sometimes when people are under huge amounts of anxiety, some people don't eat at all. Right. Others go in quite the opposite direction. And it sounds like this can be all related into one phenomenon.
Right, and right now with binge eating disorder, people mistake, you know, it's not just overeating. There's also a lot of feelings and emotions associated with it. You know, guilt, remorse, sadness, you know, feeling bad about their behaviors, and it can interfere with their, you know, day-to-day activities. They hide the behavior, and it's uncomfortable, and people, you know, spend a great deal of time thinking about it, how they might overcome it, and, you know, strategies to implement so that they can prevent this from happening.
Are these people that, let's say, for example, they go home, I guess, you know, at night from work, and maybe they have a lot of stress at their workplace? Are they the ones then that overeat like a bag of potato chips, not just a portion? Are they just binge eating to that extent?
Sometimes, I mean, some of the reports that people tell me, you know, they may try very hard throughout the day to maintain appropriate intake, but then for whatever reason, oftentimes the binge episodes are something that occur very rapidly, often done in secret. One lady told me, like, for instance, she was so embarrassed about her behavior that she would, you know, maybe on the way home from work, she'd stop and get a meal, and then she'd go home and prepare the meal and then have that meal as well. And then once she would, you know, put the children to bed, she would find herself isolating to her room and have, you know, or some of us may just have like a, you know, a bowl of ice cream or something. It may be the, you know, a carton or even, you know.
Or like an entire, it's a,
yeah.
And they eat in quantities.
Yeah, and it's uncomfortable, they feel badly, and so it's a very disturbing process for them.
And these are oftentimes people that we may have as co-workers, and you see them around that are obese, and they oftentimes, you don't see them eat that much, or when you're with them in public or go out to lunch with them, they don't overeat then, but yet when you know when they weigh, if they're grossly obese, then there has to be something going on after hours.
There is, and not everyone is to that level of obesity. Sure. And you know, it affects all people, men and women, usually women more than men.
Because we're more emotional.
And that's why, you know, the two tie hand in hand, you know, and it's just a matter of, you know, identifying what the issue is and then providing appropriate intervention.
Do they feel remorse, guilt, and shame while they're doing this or after it's over?
I think, you know, some people report, you know, knowing, going into that, knowing they shouldn't do it, already having the negative thoughts, but then it's a sense of loss of control. And of course, then, you know, afterwards there is that guilt, that, you know, the remorse, you know, what could I have done differently? And it's just kind of a pattern that, you know, people feel very shameful about, and eventually, you know, it can affect their mood and cause some issues for them.
Certainly, if depression goes without medication and so forth, or without someone getting help, it can escalate to a place, a very dark place. Right. And that's one of the things that you're doing at CNS. You're working with people to keep them from getting to that point.
Right, and we're looking at medications that we can utilize to help control some of the symptoms. Some of the very same neurochemistry that's involved with depression and anxiety is is present in this condition as well, and so the medication is targeting those areas to hopefully reduce the number of binge eating episodes.
What type of medication is this then? Would this be an antidepressant type of medication?
It's not on the market currently, and recently Vyvanse has been approved for binge eating disorders, something they also use for ADHD, and it's a stimulant medication. This medication is a non-stimulant medication, meaning that there's less risk of becoming more habit-forming or any concerns that you have with controlled substances. But it targets several different neurochemicals in the brain to help reduce symptoms.
And that's wonderful you guys are being able to. Now, if anyone's watching today and they think that they may be a candidate, or we're talking about something that you can relate to, what should we do, Susan?
They can simply call our office or visit our website. We have the ability to have same-day appointments, so they can meet with me, the nurse practitioner, or either Dr. Rommel, our psychologist. We also have other nursing staff on hand that will be happy to assess your symptoms and discuss options.
And it's very important to catch it early and not to feel embarrassed about it. The other nice thing is if someone actually already has a primary care physician, you can come to CNS Healthcare in addition to your regular physician, correct?
Of course, and and there's no cost to the patient, for coming in. So that's the other thing, that you don't have to worry about co-pays or anything like that, and we'll be happy to assess and see if that one of our programs would work out for you.
Sounds great. Wonderful information. I hope it helps.
Yes, thank you.
Okay. Coming up next, the Home and Patio Show is just around the corner. One big vendor is there each year is Gutter Helmet. We're going to speak with them next and see what they have to offer. Plus, the National Championship for Curling is going on this week at the Jacksonville Veterans Memorial Arena. It is the first time any venue in the state of Florida has hosted anything like this, a Winter Olympic sport, which teams actually attempt to slide large stones across the ice to a specific target. It's pretty unique to see and fun to watch. We'll be right back.